Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Mustafa. May I know what brings you here today? Mm-hmm. Okay. Anything else? Mm-hmm. I'm really sorry to hear about it, Mr. Mustafa, and I totally understand how a stressful situation would be for you. And I appreciate that you are concerned about your health and you came to visit the clinic. Before we proceed to the management plan, I'll ask you a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Mustafa. So can you tell me where is the pen exactly? Mm-hmm. Okay, how you will rate your pen if you may on the scale intensity of 0 to 10, 0 being 0 means minimum and 10 being maximum. 6, okay, and how did it started? Okay, what makes it better? And what makes it worse? Okay, does it travel to any other area? Is there any other joint involved? Okay, is there any history of trauma? Have you noticed any fever? Any significant weight loss recently? Okay, have you noticed any morning stiffness which lasts for more than 1 hour? If you are married? Okay, do you have kids? How's your married life? Okay, Mr. Mustafa, do you have any eye discharge? Noticed any night sweats? How about your bowel habits? Okay. Okay, is there any history of fracture in past? And do you have any high blood pressure? High blood sugar? Any family member, immediate family member suffering from the same complaint? Family history of high blood pressure, high blood sugar, or problem? Okay, Mr. Mustafa, if you are taking any medicine regularly or prescribed by a doctor or over the counter, do you have any drug allergies? Okay, Mr. Mustafa, I'll ask you a few personal questions. Is it okay with you? And do you smoke? How much per day? Have you ever tried to quit this habit? Okay, Mr. Mustafa, we'll discuss this in the next appointment. Okay. And do you drink? Okay. What do you do for a living? How's everything at workplace? And how about everything at home? Okay, Mr. Mustafa, can you tell me what concerns you the most? Okay, Mr. Mustafa, to better understand, I would like to examine you. Is it okay with you? Thanks for your cooperation, and please come on the couch. And then I'll sanitize my hands and I'll let them dry, and then I'll start from look, feel and move. So I'll look at the skin for erythema, redness, and for swelling, ecchymosis due to the trauma, and then I'll feel the temperature and compare on both sides, and then I'll move passively, and I'll ask patient to flex for flexion and bend his knees, and I'll check a range of movements, and then I'll ask patient to extend his knees, and while extending I'll check range of movement, and then I'll check ask motor power against the resistance by asking patient to flex his knee, and then again by asking patient to extend his knees, and then I'll do a special test, AP and posterior draws test. I'll ask patient to lie supine with knee bent 90 degree, and I will stabilize foot with hip and will place thumb over the anterior knee joint line and pull the tibia anteriorly, and likewise I will pull tibia posteriorly, and then I'll do a McMurray's test to test medial and lateral menisci, and I'll ask patient to supine with knees flexed at 90 degree, and will stabilize patient knee over distal quadriceps muscle, and will grip patient's heel with other hand and applies long axis compression, and then will rotate tibia internally while applying varus force, and then rotate laterally while applying valgus force, and then I will do patellar grinding by compression of patella against the femur by cupping the knee. Thanks for your cooperation, Mr. Mustafa. You can come on the chair, and thanks for your cooperation. And then again, I'll sanitize my hands. Thank you, Mr. Mustafa. In order to confirm my diagnosis and rule out other conditions, I offer you certain tests. Okay, but before I offer you certain tests, I'll like to ask if you have undergone any investigation or X-rays so far. Yeah, Mustafa, 55 years. Okay. So X-ray of both knees. And CBC, ESR, lefty. Okay, and TCCP. Okay, Mr. Mustafa, and the information you have shared with me and examination I have performed, most likely you have a condition called osteoarthritis of both knees. And do you know anything about osteoarthritis of the knee? And do not worry, Mr. Mustafa, I'm here to tell you. Okay, it is an age-related condition in which natural wear and tear takes place, and mostly in the weight-bearing joints like knee, hip, and ankle. Okay, and it occurs mostly in the middle age, both men and women equally affected. Okay, and for certain lifestyle changes. Okay, and I'll encourage you to consider quiet smoking. Okay, because it weakens the bones and reduce alcohol to safer limits, and reduce excessive weight by exercise like swimming. Okay, and I'll encourage you to use a stick or walker for walking as support, and do not climb the stairs excessively, and try to not do not squat. Okay, and I'll offer to refer you to physiotherapy for exercise. Okay, and these exercises are meant to straighten muscle around knee joint, and hence prevent friction of bones and decrease pain. Okay, and moist is prefer added infrared or shortwave diathermy, but a physiotherapist will decide about it. Okay, and they may also offer you TENS. Okay, is it okay with you? Okay, and let's talk about the pharmacological management. And so, Mr. Mustafa, here is the topical NSAIDs. Okay, I'm prescribing you ibuprofen cream. Okay, and you can apply it on your joints. Okay, and I'll offer you paracetamol 1 gram. Okay, and 3 times per day. Okay, and if you pain not relieved, and we have another option. Okay, and so here is my contact. You can update me about your pain. Okay, otherwise I'll switch you to the ibuprofen 400 mg thrice a day. Okay, or diclofenac sodium 75 mg thrice a day. Okay, is everything clear till now? Okay, Mr. Mustafa, if your condition did not improve and you continue to have severe pain, I may refer you to orthopedic surgeon who may consider a partial or total joint replacement, and the life of artificial joint is around 10 years. Okay, but it's just a future plan. Okay, God forbid. Okay, is everything clear till now? Is there anything else you would like to discuss with me today? Okay, Mr. Mustafa, I wish you a speedy recovery. Here is a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Take good care of yourself. Bye-bye.